His name is Henry, identified in court papers as 2-year-old HK. Henry's parents sat in court today as their lawyer told jurors the boy suffered an aneurysm in 2019. Their lawsuit says doctors at Seattle Children's first misdiagnosed Henry's brain condition, and then
the child ended up in operating room number 9. The operating room is supposed to be a sterile environment. It was not.
Operating room number 9 at Children's. It was here that the treatment team removed a flap from the boy's left skull to access his damaged brain.
This is the imaging of the part of the skull that's removed.
Days later, the skull fragment tested positive for Aspergillus mold, an infection the lawsuit says was caused by the rash of mold infections that forced the hospital to close and scrub its ORs in 2019.
There should never have been Aspergillus in an OR.
In the summer of 2019, the hospital said a patient died from Aspergillus infection and several others were sickened. Later that year, after a series of King 5 reports, the hospital admitted 5 other patients had died since 2001, linking the mold to a faulty ventilation system in the operating rooms. They have since been upgraded.
This is not a case about an Aspergillus infection. And that's because Henry did not have an Aspergillus infection.
The hospital's legal team says Henry never suffered from an Aspergillus infection because the infected bone was never placed back in his skull as originally intended. The hospital denies many of the lawsuit's allegations. But Henry's lawyers say he suffered complications from a plastic skull piece that doctors used to replace his skull bone. At age 5, Henry is severely disabled.
So what you can see is that he's in braces on his right leg. And if you watch, he doesn't use his right hand. And the hope is that that'll get better over time.